Hello nurses, welcome to another session of Nurse Talk. Today we are going to have a continuation of the question paper discussion from the previous years. Okay, so now we are going to discuss question number 69. Question is, the most used site for test dose of medication is option A forearm, option B gluteal region, option C deltoid muscle, and option D is fingertips. So it's a very easy question and everybody know that the answer is forearm or option A. For a test dose of medication, we always use the forearm and the route is intradermal. We use intradermal route and the site is forearm of the patient for the test dose of medication. And question number 70, the pneumatic bed is used to prevent option A joint pain, option B pressure ulcer, option C back pain, and option D hip pain. So the pneumatic bed is used for the prevention of option B pressure ulcer or decubitus ulcer or pressure sore. Okay, pressure sore, pressure ulcer or decubitus ulcer of the patient can be prevented by the using of pneumatic bed. Question number 71. A client with Parkinson's disease is experiencing anorexia and vomiting since beginning of the treatment with levodopa. What should be the initial action? So you may remember the patient has gotten a diagnosis of Parkinson's disease and the patient is getting medication levodopa. So what is the why is the patient experiencing anorexia and vomiting while administering the medication? Option A, assess the food preference. Option B, monitor blood pressure. Option C, hold medication, and D, or administer medication with food. Remember, when a patient is diagnosed with Parkinson's disease, the medical management will be levodopa. So whenever we are administering a patient with levodopa, we can see that the patient will be having a combination drugs of carbidopa and levodopa together. Okay, that is used because a patient can have gastrointestinal irritations when the patient receives levodopa. In this case, there is no option of carbidopa given. So the answer is administer medication with food. Levodopa medication should be always administered with food in order to avoid side effects like anorexia. What is anorexia means? Anorexia means reduced appetite, or the patient is refusing to eat food or take food. That is anorexia and vomiting. So in order to avoid the side effects, the patient's medication should be administered along with the food. Question number 72. Core body temperature is highest in the option A early morning, option B noon, option C late afternoon, and option D is night. This is a nursing foundation question. The answer is always the core body temperature of a person is highest in the late afternoon, or option C. Option C is the right answer. Core body temperature is highest in the late afternoon. 73. Question number 73. Which one of these is not a cardiac biomarker? What is a cardiac biomarker? Cardiac biomarkers are markers in blood. That is the markers in blood which help us to identify if the patient has got any cardiac issues. For example, if a patient has got a chest pain today and the patient has not gone to the hospital, but the patient is going to the hospital after 2 days, and when the patient get admitted to the hospital, the patient is saying, when we are doing a history collection, the patient is, imagine a patient is saying that I had a chest pain 2 days back, but it is not there at the moment. That time, we can utilize the cardiac biomarkers in blood, which will identify if the patient has got any cardiac issues, or if that was the reason for the chest pain. Was the cardiac issue a reason for a chest pain? That can be identified by the cardiac biomarkers. The major cardiac biomarkers are creatinine kinase, troponin, and myoglobin. If you are working in any hospitals or if you have a placement in hospital, we have always heard about creatinine kinase and troponin checking for a patient with cardiac abnormalities. Okay. So the question is, which one of the following is not a cardiac biomarker? So obviously the cardiac, among the options, the alkaline phosphate is not a cardiac biomarker, and creatinine kinase, troponin, and myoglobin are cardiac biomarkers. And if the question comes up like, what is the most important, like most definitive cardiac biomarker? If a question comes up like that, the answer is troponin. Troponin is the most definitive cardiac biomarker which shows the exact result. Okay, that is troponin. Question number 74. Patient presents to the emergency department with the blood pressure 180/130. That is hypertension, headache, and confusion. Which additional finding is consistent with diagnosis of hypertensive emergency? So we are assessing a patient who has a hypertension, headache and confusion. So what additional finding among the options shows that the patient has a hypertensive emergency? Option A is retinopathy. Option B, bradycardia. Bradycardia means reduced pulse rate. Option C is jaundice, and option D is urinary retention. If a patient has a hypertensive emergency, along with the hypertension, headache and confusion, the patient will show retinopathy. Retinopathy is affecting the eyes of the patient. So retinopathy will be coming along with hypertension, headache and confusion for a patient if the patient is having a hypertensive emergency. Question number 75. Nurse understand that providing a complete bed bath may have which of the following cardiovascular effect? She therefore plans for rest periods during the bath. So this question has been deleted from this question paper because it is not a right question, or the option is not right in here. So just because we are reading it, I am just saying when we are providing a complete bed bath for a patient, what's happening for the patient is patient will have an increased blood flow, increased blood supply to the skin. Okay, the patient is going to have an increased blood supply to the skin, but I'm not going in detail in the question because this is deleted from the question paper. Okay, and question number 76. Cushing triad refers to set of signs that are indicative of option A, increased intra-abdominal pressure, option B, increased intrathoracic pressure, option C, increased intraocular pressure, option D is increased intracranial pressure. In the same question paper, I think the question was like 8 or 9. In the same question paper where we discussed, there was a question about increased intracranial pressure or increased ICP. That time I said clearly that if a patient has an increased ICP, always remember Cushing's triad. Always remember Cushing's triad is increased ICP. So the question here shows Cushing triad refers to the set of signs that are indicative of. Obviously the answer is increased intracranial pressure. Increased ICP always goes with the Cushing triad. What is the normal intracranial pressure? 5 to 15 mm of Hg. Okay, so that is a normal intracranial pressure. If the patient has got an increased ICP, what are the conditions where the patient can have an increased ICP? ICP can be increased if the patient has got any trauma or injury to the brain, or intracranial hemorrhage or hematoma inside the brain, or if the patient has got a glioma or tumors inside the brain. That time the patient can have an increased ICP. So increased ICP is always manifested by Cushing triad. What is Cushing triad? Cushing's triad. What is Cushing's triad? Cushing's triad is bradycardia, hypertension and irregular breathing. Okay, you have to by heart it. The Cushing triad is bradycardia, hypertension, irregular breathing. So if the patient has got a reduced pulse rate, increased BP, and the patient has got an irregular breathing, that says the patient has got an increased intracranial pressure, and this is Cushing's triad. So Cushing's triad, whenever somebody say you Cushing's triad, it is increased intracranial pressure of the patient, and the patient is manifesting bradycardia, hypertension and irregular breathing. Okay, question number 77. Which of the following is a type of a generalized seizure? Option A, absent seizure, option B, pseudo seizure, option C, partial seizure, and option D, complex partial seizure. Okay, so seizures are divided into two. First one is generalized seizure and partial or focal seizure. First one is generalized seizure, partial or focal seizure. The question here is which of the following is a type of generalized seizure? So obviously it is not partial seizure. Okay, or complex partial seizure. In generalized seizure, we have subdivisions. There are generalized seizure is again classified into, first one is tonic-clonic seizure, myoclonic seizure, atonic seizure. Okay, if you don't know much about the seizures, I have done a video on different types of seizures and management of seizures. You can please go back and watch the videos, so you will get an idea of types of seizures in detail. So generalized seizures are divided into tonic-clonic seizure, myoclonic seizure, atonic seizure, and again absent seizure. Okay, this partial seizure is a different types of a seizure. It is only in that certain areas of the brain is affected in partial seizures. Okay, so the question is which one of the following is a type of generalized seizure? The answer is absent seizure. Here, absent seizure is a type of generalized seizure. Other than absent seizure, tonic-clonic, myoclonic, atonic are also type of generalized seizures. Okay. Question number 78. Which of the following is a non-drug therapy for children with epileptic seizures? Option is ketogenic diet. Option B is high protein diet. Option C is low fat diet. And option D is high fiber diet. The question is child has got epileptic seizures, and what is a non-drug therapy or non-medicative method for the management of epileptic seizures? So the answer is ketogenic diet. Ketogenic diet. What is a ketogenic diet means? Remember, ketogenic diet means increased fat and low carbohydrate. Okay, that is a ketogenic diet. Ketogenic diet is provided for the patient who has an epileptic seizures. Okay, so the answer is ketogenic diet. No low fat. The patient should have a high fat diet. High fat and low carbohydrate diet is called a ketogenic diet given for the patient who has epileptic seizures. Question number 79. Sound created by turbulent abnormal blood flow of heart heard during auscultation. So question is, what is the sound which we hear during auscultation of a patient? And the sound heard like turbulent abnormal blood flow. So options are option A friction rub, option B gallop, and option C murmur, and option D is rasping. So the right answer here is murmur. Cardiac murmur. Cardiac murmur is like a low soft sound. It is like a low soft sound heard during the auscultation, especially heard during the extra sound. It's an extra sound during heartbeat. If you are listening to the heartbeat, if you are auscultating a patient, if you can hear an extra sound, it is like a turbulent abnormal blood flow. It has like a turbulent blood flow which we heard in between the heartbeat. That is murmur. Question number 80. Which one of the following is a sound that provides systolic pressure reading, and it's the first Korsakoff sound heard as the pressure in the blood pressure cuff is released? Option A sharp tapping sound, option B swishing sound or whooshing sound, option C is a thump, and option D is a soft blowing muffled sound. So everybody know how to do a blood pressure assessment with a sphygmomanometer, yes? So what is a Korsakoff sound? Korsakoff sound are the sounds heard. Korsakoff sounds are the sound heard while assessing the blood pressure of a patient. So when we are listening to when we are auscultating the pulse of a patient while doing the blood pressure assessment, we can hear two Korsakoff. First one is first Korsakoff sound by which we assess the systolic blood pressure. And then we will go to the diastolic blood pressure. It is heard with a stethoscope when we are listening to the pulse of the patient. Okay, the first sound, the question is, what is the first sound heard during the the first sound heard while assessing the blood pressure of the patient? The answer is sharp tapping sound. Sharp tapping sound is the first sound heard while assessing the blood pressure of the patient. This is Korsakoff first Korsakoff. So may I ask you, what is the second Korsakoff sound? How is the second Korsakoff sound heard? Second Korsakoff sound. The second Korsakoff sound is a whooshing noise. Second Korsakoff sound is a whooshing sound. Third sound is a sharp sound, and then it will be going down slowly. So remember, the first Korsakoff sound is the sharp tapping sound heard while assessing the blood pressure of the patient. That is a sharp tapping sound. Second one is swishing and whooshing sound. So the question asked is what is the first Korsakoff sound heard as? That is the option A, sharp tapping sound. Next question is, which one of the following treatment strategies have been shown to improve the outcome in patients diagnosed to have Guillain-Barré syndrome? Option A, heat therapy, option B, immobilization, option D, anticholinesterase, and option D, plasmapheresis. So the question is Guillain-Barré syndrome. Guillain-Barré syndrome is a neurodegenerative and is an autoimmune disorder. Autoimmune neurodegenerative disorder resulting in the lack of reflexes in the body. It is actually caused because of the destruction of myelin sheath in peripheral nervous system. Myelin sheath destruction in the peripheral nervous system. You can go back and watch my video on Guillain-Barré syndrome. In that I have detailedly explained what is happening in Guillain-Barré syndrome. Okay, so it is occurring due to the destruction of myelin sheath in the peripheral nervous system. It's an autoimmune disorder. It's a neurodegenerative disorder. The question here is, what is the management? That is the definitive management. The treatment strategy is definitive management for a patient with Guillain-Barré syndrome. Option A, heat therapy. Option B, immobilization. Option C, anticholinesterase. And option D, plasmapheresis. Always remember, if the patient has got an autoimmune disorder, especially in Guillain-Barré syndrome, the management is plasmapheresis. Plasmapheresis is a plasma infusion. It's a plasma infusion for a patient, because the patient is already having an autoimmune disorder where our own immunity is affecting our body. So the plasma infusion is the plasmapheresis. It's not just for Guillain-Barré syndrome. Plasmapheresis is used for multiple sclerosis also, and also myasthenia gravis. Disease condition like multiple sclerosis or myasthenia gravis can also be treated by plasmapheresis, because they are also autoimmune disorders. Okay, see the option here, anticholinesterases. Anticholinesterases can be a medical management for disease condition called myasthenia gravis. Anticholinesterases can be a medical management, but definitive management is always plasmapheresis. Yes, this question is asked for Guillain-Barré syndrome. The management is plasmapheresis. If the question was for multiple sclerosis, again the answer is plasmapheresis. Plasmapheresis is a plasma infusion used for the management of autoimmune disorders. Okay, the next question is, Parkinson's disease include all the symptoms except. So Parkinson's disease, we already have discussed a question about Parkinson's disease the previous before the previous questions. Okay, so the option is option A, bradykinesia and loss of postural reflex. Option B, stiff limb. Option C, thunderclap headache. Option D, tremor of hands, arm, legs, jaw and face. When somebody say Parkinson's disease, remember a classical triad of Parkinson's disease. That is tremor, rigidity, bradykinesia. Even if somebody asks you while you are sleeping, you should know these three things. Parkinson's disease, tremor, rigidity, bradykinesia. Remember, tremor, rigidity, bradykinesia is seen in Parkinson's disease. Tremor means involuntary movement. It is like a pill rolling. It's always also called pill rolling. That means imagine if you have got a pill between your fingers and you keep on rolling it. That is like a tremor. That is a tremor is seen in Parkinson's disease. And rigidity means stiffness. Rigidity means stiffness of the body, that you cannot have a proper voluntary movement as you like. So that is rigidity. And next one is bradykinesia. Bradykinesia means reduced movement. The patient is struggling to have a proper movement. That is bradykinesia. So the triad in Parkinson's disease is tremor, rigidity, bradykinesia. Always remember that. Now we'll go back to the options. The first option is bradykinesia and loss of postural reflex. Of course, that is a symptom of Parkinson's disease. Second one is stiff limb. Yes, stiff limb or rigidity. That is also a symptom of Parkinson's disease. Third one is thunderclap headache. And option D is tremor of hand, arm, legs, jaw and face. That is also a symptom of Parkinson's disease. The question says exception. Like what is not the symptom of Parkinson's disease is a thunderclap headache. Thunderclap headache is the right answer here. Option C, thunderclap headache is the right answer, because in Parkinson's disease, the patient will be having tremor, rigidity and bradykinesia, not a thunderclap headache. The headache, that is thunderclap headache, is a very, very severe headache that is seen in the patient with increased ICP, intracranial hemorrhage and maybe tumor, etc. So these are the disease conditions where the patient will have a thunderclap headache. But in Parkinson's disease, the patient will always come up with bradykinesia, rigidity and tremor. Okay, question number 83. Which term would the nurse use to document pain at one site that is perceived in another site? Okay, option A, referred pain. Option B, phantom pain. Option C, intractable pain. And option D, aftermath pain. So the question in here is, patient has injury on one side, but the patient is experiencing pain on another side. For example, imagine this is the head of a patient and the patient has got an injury here. Injury is here, but the patient's pain is here. They are asking what is the name of this thing, this condition. This is referred pain. referred pain. Referred pain is where the patient will have injury on one side and the pain will be affecting on the other side of the, which is not on the injury side. The patient is experiencing pain not on the injury side but on the other side of the body. This is called referred pain. Phantom pain is usually seen in a patient who has got an amputation. Okay, even if the limb is not there, the patient will still feel pain. That is called phantom pain. So the question here is, the terminology the nurse used to document pain not one side and the perceived in another side. That is called referred pain. The answer is option A, referred pain. Question number 84. The two main factors for determining blood pressure are peripheral resistance and which one of the following? So the blood pressure can be determined by what factors? First factor, they have given the first factor is peripheral resistance. They are asking for the second factor. Option A, cardiac output. Option B, age. Option C, pulse pressure. And option D, pulse deficit. The answer is cardiac output. Remember, the blood pressure can be determined by peripheral resistance and cardiac output. Okay. And when we are on this question, let me ask you, what is pulse pressure and what is pulse deficit? Pulse pressure and pulse deficit. This question has been asked a couple of times for the government examination, MCQs. That's why I'm asking. What is pulse pressure and pulse deficit? Pulse pressure. Remember, the pulse pressure is the difference between excuse my handwriting, difference between systolic and diastolic blood pressure. Imagine a patient has a BP of 120/80. The pulse pressure is 120 minus 80, that is 40. Okay, this is the pulse pressure. Pulse pressure is the difference between systolic and diastolic blood pressure. So what is pulse deficit then? What is pulse deficit? Pulse deficit is the difference between pulse deficit. It is also difference between heart rate heard on apex of the heart or on the chest part, apex of the heart, and also the different pulse on periphery. For example, if you are assessing a pulse deficit of the patient, first we will listen to the heart rate from the apex of the heart, from the chest itself. Okay, and we can use by a stethoscope, apical pulse. That is the apical pulse. Apical pulse minus peripheral pulse. Peripheral pulse can be assessed by the by palpitation, like you know what, how we assess the pulse from the brachial artery, or how we assess the pulse from the wrist. That is a peripheral pulse, or we assess the pulse from pedal pulse on the extremities. Okay, so the pulse deficit is the difference between apical pulse and peripheral pulse, where the pulse pressure is the difference between systolic minus diastolic is pulse pressure. Pulse deficit is apical minus peripheral. Okay, did you get an idea of pulse pressure and pulse deficit? Okay, so that is the difference between pulse pressure and pulse deficit. And the question was, what are the factors determining the blood pressure? The factors determining blood pressure are peripheral resistance and cardiac output. And the right answer for this question is cardiac output. So I was only going to say the pulse pressure and pulse deficit because I saw these two terminologies. And I'm sure that this has been asked numerous times in different examinations. Don't want to miss that question. Okay. Thank you very much for watching the video. I hope it was a bit helpful for you for preparing for the upcoming examinations. And thank you very much and see you soon. Bye-bye.